The following segment is sponsored by Forum Health.
February is a month of romance and love, and as couples get older, a lack of desire can happen, largely due to low hormones. Well, Forum Health Greenville wants to help, and we've got Dr. Connie Casebolt here to talk about it. Good morning.
Hello, and thanks for having me.
I'm glad you're here. You know, both men and women start losing their hormones starting around age 30, you've said. How does that affect them?
Yes, so there are so many symptoms that can happen. When women eventually go through menopause, they can get the night sweats, hot flashes, vaginal dryness, insomnia, mood changes, even heart palpitations and muscle cramps can happen. Men can, they don't go through menopause, of course, but their hormones will gradually wane with age.
Right.
And they can get apathy and moody and belly fat. And then in both genders, they can lose that hormone that causes desire.
Right. You said for couples, the whole relationship, for that reason, ends up being strained by low hormones. You've seen that happen a lot.
Oh, many times. And unfortunately, it will be asymmetric. One member of that couple, typically the woman, because she's going through menopause, will lose that desire, and then that leaves her husband feeling excluded and left out and unappreciated and unloved even.
Yeah, and that's not healthy. So we're here today to really talk about a method for restoring those missing hormones that are at the root of it all. It's pellet therapy. Walk us through how that works.
Yes, so pellets are small. They're about the size of a large grain of rice. They're sterile, of course, because we implant them in a very simple, painless procedure where they land in the upper outer quadrant of the buttocks and our fat tissue. And once they're there, they slowly release over the next 3 to 4 months, and that person feels like 20 years has been taken off the clock.
And this has been life-changing for so many of your patients. One of your patients that we talked to says pellet therapy helped her really relieve her symptoms when nothing else was working. She'd had a hysterectomy, she'd gained a lot of weight, and here's what she had to say.
I was not intimate with my partner, and I felt very fatigued and depressed and bloated and not sleeping well, hot flashes and the whole 9 yards. I didn't want to spend the rest of my days being that miserable. And I came to Forum Health and I got my hormones tested and realized that they were way out of whack. And now, being 49, I have wonderful intimacy several times a week. I sleep well, I've lost the weight, I feel better, and I'm an all-around healthier person.
Wow. Well, listening to how her life was changed by this therapy, that must be such rewarding work for you. How big a difference does it make for people?
It's huge, and it's really why I love what I do so much, because her story is one of hundreds. We've had men say, "You gave me my wife back."
Yeah.
And I think some men have even sent me roses because they're so thrilled the fact that they've got a loving wife that wants to be intimate with them again.
That's a beautiful thing. And the process with you all starts with lab work. That's how you can determine hormone levels or deficiencies in B12 or vitamin D or even issues with thyroid or kidneys. You're offering a special this month. Tell us about that.
Yes. For Valentine's, the month of Valentine's, we are offering $100 off your initial lab work. And our lab work is already heavily discounted, so this is a real deal. And we're going to test, like you said, a variety of things because most people have more than one issue. So we're going to try to find that and then correct all of these so that we're trying to get people back to optimum health.
Well, excellent. And as a functional medicine practice, I know Forum Health Greenville really does a lot. On top of the hormone health, you also help patients with things like weight loss, beauty, aesthetics, those types of treatments. Anything else you want people to know about it before we go?
Yes, we have nutritional IVs. So some people want that little pick-me-up for energy. So we've got nutritional IVs. As you mentioned, aesthetics. We have a fantastic weight loss protocol coming in the next 2 weeks, just in time for spring. But we're here to help people achieve optimal health and kind of get back to that younger self that they wish they had.
Well, we look forward to talking about so many of those topics with you. And anybody watching now can consult with you. They can get that lab work done and get started. They visit forumhealthgreenville.com or call the number on screen, 558-0200. Dr. Connie Casebolt, thank you so much for being here.
Thank you.